Lysergic acid diethylamide, better known as LSD, is a hallucinogen that has been around since the 1960s, and thus goes by a variety of street names such as acid, blotter, California sunshine, dots, electric Kool-Aid, and many more. LSD itself is colorless, odorless, and tasteless, and thus it is typically consumed orally and can be found being added to absorbent blotting paper that is often decorated as shown in the picture on the screen. LSD is very potent, and thus ingesting even 25 micrograms of LSD is enough to feel its effects. LSD was first synthesized by a Swiss chemist by the name of Albert Hofmann in 1938. Hofmann was deriving different compounds from lysergic acid in the hopes of finding new medications, which he indeed did. Hofmann was able to find several medicines, including ones that lowered blood pressure and even one that improved brain function in the elderly population. While deriving different compounds from lysergic acid, Hofmann stumbled upon the 25th derivative of lysergic acid, called lysergic acid diethylamide, or LSD-25. Hofmann believed that LSD-25 would stimulate circulation and breathing. However, further testing did not prove anything of the sort, and thus testing of LSD-25 was abandoned, until about 5 years later, when Hofmann returned to LSD-25 testing and accidentally ingested some of it. After he ingested some of it, he discovered he was in a dreamlike state in which he perceived intense, beautiful shapes and colors. Taking LSD typically causes a person's perception of things around them to shift drastically, as well as what they think and feel. This is commonly referred to as a trip. During a trip, a person typically experiences visual effects such as colors appearing stronger and lights becoming brighter. LSD users typically also see patterns, shapes, colors, and textures as shown in the picture on the screen above. Along with its visual effects, LSD also appears to have an effect on emotions. People on LSD often report feelings of happiness and euphoria. However, LSD makes people very emotional, and this can also take a turn for the worse depending on the setting around the person and the state in which the person is already in. Typically, LSD is used at festivals and purely for fun. However, there are/have been other uses for LSD, for example, therapy in the 1950s. In Europe, psycholytic therapy was common, and in this, psychiatrists gave patients low doses of LSD, about 50 micrograms or less, over several sessions, and encouraged them to focus on their childhood and subconscious. American psychiatrists, on the other hand, were more likely to use psychedelic therapy, in which they gave their patients high doses of LSD, approximately 200 micrograms, over just a few sessions. And instead of bringing out childhood memories, these doctors hoped the high doses of LSD would elicit a positive spiritual awakening and encourage patients to find meaning in their lives. However, by 1974, the National Institutes for Mental Health, NIMH, declared that LSD had no real therapeutic value. In the 1980s, a team of researchers believed that LSD could be beneficial to terminally ill patients because it would help them stay aware of their surroundings, it would relieve them of their pain, and make them feel more connected to their families. The study ended, however, before it really resulted in any concrete findings. Since 2010, there has been a resurgence in LSD studies for a variety of mental health applications. Psychotherapists are revisiting LSD as an assistive chemical meant to boost patients' abilities to address trauma, depression, and other maladies. Other researchers see LSD as a key to alleviating the emotional strife for people who are struggling with terminal illnesses and end-of-life emotional stress. Researchers believe that LSD works in a way similar to serotonin, which we all know as a neurotransmitter that is responsible for regulating mood, appetite, muscle control, sleep, sexuality, and sensory perception. LSD seems to alter the way the brain's serotonin receptors work. It may inhibit neurotransmission, stimulate it, or do both. It also affects the way that the retinas process information and conduct that information to the brain. For this particular presentation, I will be focusing on LSD and how it helps with anxiety in relation to life-threatening diseases. In a study conducted by Peter Gasser and his colleagues, 12 patients who had extremely high anxiety related to the life-threatening diseases that they themselves had were given psychotherapy sessions. 2 of which were LSD assisted, and the others that were drug free. The participants themselves received either 200 micrograms of LSD or 20 micrograms of LSD with an open label crossover to 200 micrograms of LSD after the initial blinded treatment was unmasked. After the 2-month follow-up, positive trends were found via the State Trait Anxiety Inventory (STAI) in reductions in trait anxiety and state anxiety. STAI reductions were therefore sustained for 12 months, and because of that, the results indicate that when administered safely in a methodologically rigorous, medically supervised psychotherapeutic setting, LSD can reduce anxiety, and thus this study shows the power of LSD when used in a controlled setting along with therapy.